What's going on, everyone? Happy Wednesday to everyone. Hopefully everyone is staying safe and healthy. If you had to take a COVID test, hopefully you have tested negative. And if you live in the northeastern states today, particularly the I-95 corridor, from say about Baltimore on up through New York City, maybe even into Connecticut as well, hopefully you are keeping safe today because the air quality is rather bad simply because we have wind blowing in the smoke from the wildfires up in Nova Scotia and Halifax, and also here in my city in Philadelphia. We're getting a double bubble. Within the last hour, there is a major, massive junkyard fire going on over in the Wissanomi section of the city, over near Interstate I-95. And that's creating a huge plume of smoke. And the health department has issued warnings for people in that area to actually stay indoors. Do not go outside if you're in that area right now, because the air quality is especially bad. Hopefully the wind does not blow that my direction. I'm up in the northeast section of the city, so we'll have to see. Alright, starting off today with India. India records 310 new COVID-19 cases and 3 deaths. Alright, moving on to this. This is something that's really interesting. We're not going to go too much into details on this because I think it's going to become a video of its own. Look for it maybe tomorrow or Friday. List of coronavirus-related restrictions in every state. Yes, AARP has done an updated list. It says updated, May 30th, 2023. That was just yesterday. And you can actually go here through every state and see what the list of restrictions are still. Does masking still get required in healthcare? Are there masking in schools? Which obviously, there's no masking in schools right now, but is masking mandates prohibited in your state? You can go state by state. And I'm going to leave this link down below for you to check for yourself. But again, I think we're going to do a video on this either tomorrow or possibly Friday, because I do want to do an updated version of the help wanted, staffing shortages. We did one, I believe it was last month we did one. It's time for another one. I've been looking. There's quite a few of them. Alrighty, moving on to our next story. This is just totally ridiculous. We're just going to read the headline here, and you'll see why it's ridiculous. Former Connecticut lawmaker sentenced to 27 months in jail for stealing COVID-19 funds from West Haven. Why would you steal coronavirus funds? Totally ridiculous and inappropriate. More on stealing COVID funds in a moment. Let's go to our next story first, though. In Pontiac, Michigan, a COVID outbreak at a homeless shelter leaves nonprofits struggling to help those most vulnerable. So this is not good. They currently have 36 people as of today out with COVID, including 4 or 5 staff members. So this is really bad. Now let's go back to stealing COVID funds. This is from The Hill. Debt ceiling deal claws back COVID-19 money. That's right. If this should pass, tonight there's going to be a vote on the debt ceiling. If you've been following along, the debt ceiling is set to expire in just about, I think there's about 7 days left. In the beginning of June, the debt ceiling is going to expire. We're going to default on our debt if they do not pass something. Biden and McCarthy came to an agreement over the weekend, and it passed another hurdle last night. But tonight there's going to be another vote on this. If it doesn't pass the vote, well, then it's back to the drawing board. But this current plan, this current deal that they're trying to vote on, actually would take back some COVID funding. This is not good. And this is why I think, I've said this before, states that do have leftover funding, cities that do have leftover funding, should be using that towards continued testing clinics and vaccination sites and test to treat. Test to treat should have never gone away. Moving on to this, Ruthie Ann Miles, who apparently is a Broadway actor, has revealed that she has tested positive for COVID. Very interesting. Usually you hear them say mysterious illness nowadays, but this one actually stated, no, it's coronavirus. I'll be adding that to the COVID positive archive on the website, which, by the way, yes, it's a very long process. Eventually I will get around to doing the categorizing of the COVID positive cases. Just haven't had time to do it. Maybe I do some tonight. Maybe it waits till the weekend. I don't know. Eventually I will. I promise I will get to that. Moving on to this. Arizona and California release their weekly COVID updates. So Arizona, if you live in Arizona, it's actually good news. If you live in California, it's some really bad news. I'll explain. First off, Arizona. They had 1,717 cases in the last week. Or, excuse me, in the previous week. This week they had 916 cases. That's a significant drop. However, we come down here to California, and last week you had 1,058 cases. Not terrible. This week, 6,408 cases. That is a massive 1 week increase. I don't know if there's any backlog added to that, but we do know the XBB.1.16 variant, it's on the rise out in the West Coast. So yes, it is rising there. And also, this is interesting. California, unlike Arizona, saw a slight decrease in their death numbers. However, Arizona, despite the drop in cases, saw a slight increase in the death numbers. Alright, moving on to this. I thought today we would add this. This is something I actually just found. So this has to do with ER wait times. Not too concerned about that part, or at least the statistics up here, because that doesn't factor in COVID and everything else. That's just statistical. But let's read some of these comments down below. On May 24th of 2023, that's just about a week ago, my son was brought into South Suburban Hospital in Hazel Crest, Illinois, just before 9 p.m. by ambulance, as he was hit by a car. Oh, this is sad. And it is nearly 1 a.m. and all they have done is an x-ray upon arrival. And vitals with him sitting in a wheelchair in the waiting room bleeding. Yep, that's not good. How about we come down to another one? Here we go. Here's this is at Johns Hopkins. Over 18 hours this person waited. Kate. Here's May 15th of 2023. I was in yesterday with acute abdominal pain. Waited in the lobby for 4.5 hours, followed by blood work and stomach CAT scan. I was admitted and got settled in at midnight. Excellent doctor and nursing care. So this is a slightly better story, but the first couple, bad. So every now from time to time, we're going to check in on this, see what people are experiencing in the hospitals. Tell me, do you know someone who had to deal with a hospital recently? Did they have to wait a long time? Did they have a good experience? I don't know. I want to know about it. Tell me down below. Alright, moving on to our next story here. John Beasley, actor on Everwood and The Soul Man, has died at 78 years old. So sadly, John Beasley has passed away. It looks like it might have been something related to his liver. It says here he had been ongoing tests on the liver before taking an unexpected turn for the worse. So sadly, he has passed away. Alright, moving on to this. Speaking of hospitals and medications, let's switch to the friendly neighborhood pharmacy now. And have you had trouble at the pharmacy lately? Maybe you walk in and you notice the line is really long. Or, like me, I noticed not only has the line been really long at my pharmacy, behind the counter is just totally ridiculous. The number of prescriptions. The shelves look like they're ready to collapse because there's prescriptions piled on top of prescriptions. And they have to dig and dig and dig. Say, is this me? Is this COVID data report? Is this data report? Nope. Where's he at? He's got to be here somewhere. Yeah, it's just ridiculous. So I actually asked about this. And some people say here, the drawers seem to be more tightly packed with prescriptions and more stored in baskets sitting on the floor. Yep, I believe that. It didn't register with me at my RX pickup the other day, but yes, absolutely. I had to get two, and they weren't together by Alpha, but some new number system. They were not together, and the bins were so full I could read some of the names sticking up. And here's another one. Yes, and they're out of one of my prescriptions. Oh no, sin for the win. I hope they find your prescription. Here's one. I only do mail order prescriptions and it's taking a lot longer to get them filled. Yep, and here you go. Can't tell. My local CVS replaced, sorted by last name bins with some random number system. Line length varies far more by the time of day once we got past the initial few months of the pandemic disruption. So yes, a lot of people are seeing that it's taking longer. And look at this. I did take note of this at my pharmacy counter. Aha, look at this. A shortage of prescriptions, children's medications. So let's move on to our next thing here. Walgreens, as you know, this week in Walgreens, 22.4% is the national trend. Prior week was 24.2%. Speaking of that massive increase that we were seeing in California cases, let's look at Walgreens there. 34.2% positivity. Prior week was 28.5%. It is up by 5.7%, but testing is down. But nonetheless, cases is up, so I don't know. I think it's really is rising there. This day in COVID pandemic history, May 31st, 2022, the U.S. Department of Justice asked a federal appeals court to overturn the order that declared CDC's mandate requiring individuals to wear masks on public transportation unlawful. Authorities in Shanghai announced that they are partly reopening China's largest city after 2 months of a COVID-19 lockdown that has kept millions of people strictly in their homes and employed both mass testing and isolation of anyone infected with COVID-19 in centralized facilities. Alright, moving on to wastewater. Nothing really that we can report on there today. Taking a look at New Jersey. Let's see, drum roll please. Did we get New Jersey? Because when I checked as of an hour ago, we did not have New Jersey yet, and we do. And New Jersey is now up to 195 hospitalizations. That increase is because 69 out of 70 hospitals are reporting today. 6 are on a ventilator, 16 people are in the ICU. We are supposed to get an update out of Pennsylvania today. Have not seen it yet. It's still saying May 24th. For some reason, the dashboard does not update until Thursday instead of the date that it's supposed to be on, which is Wednesday. Alright, moving on to my city, Philadelphia. We weren't too far from 800 hospitalizations yesterday. 780 total EMS incidents. I'm willing to bet a lot of them were respiratory because we're having that smoke issue. And speaking of respiratory incidents, this was just a little bit earlier in the suburban county of Montgomery County, just outside of Philadelphia. Yes, at one point, there were 22 active incidents. And look here, let's count how many were respiratory. 1 respiratory, 2 respiratory, 3 respiratory, 4 respiratory, 5 respiratory. Let's do a live look. Is it still busy out there? Slightly less busy, but nonetheless, it's been a busy day today. Taking a look at Chester County, that county is actually not busy at all right now, so that's good to see. Taking a look at New York State, 371 people have tested positive in the last 24 hours, 4.8% positivity rate. The 7-day average is 4%, and, you know, I'm very surprised about this. This is New York State as a whole. The hospitalizations, they didn't rise that much, just only rose by 15 to 555, 56 people in the ICU. Same with New York City. New York City did not rise all that much. Zoom this in to see what's going on there. And you will see here, 540, wait a second. They always do that with the refresh. It goes back to the statewide level. No, New York City actually dropped today to 187. That is some good news, but I question, are people being tested upon entering the hospital? Finally, for today, we're not going to do the international update today because we're really running out of time for that. Hopefully, we get an update out of Texas. Does not look like we got much out of Texas. This is still last week's number, which was 10,664 cases. Hopefully, we will have that for you tomorrow, and also keep an eye out tomorrow. I think that AARP, this right here, I think we're going to do something with this tomorrow. We're going to read this off, and we're also going to have the staffing shortages. I think, again, maybe either tomorrow or Friday, and of course, the pandemic update is coming tomorrow already. Thank you for watching today's video. You can always find the majority of today's stories, not all of them, the majority of them do get posted to my website, datareport.info, and of course, I retweet everything out on my Twitter account. I know we're behind on some of the stuff on my website. I'm slowly trying to catch up. Eventually, I will get fully caught up. But if you like this video, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. Thanks for watching, everyone, and until I see you again next time, stay safe.